Orientation and Functional Ability. BRN 100 Week 1. Learning Objectives. Orientation to the BRN 100 course. Orientation to online and independent university-level learning with this course. Orientation to the BRN Study Guide. Overview Pathophysiology and Pharmacokinetics Concepts. Functional Ability. Examine Clinical Judgment Model. Review Clinical Judgment Action Plan. Orientation, DIRBYH. Odd weeks, synchronous class. Week 6 for midterm will be written during class time. Even weeks. Asynchronous, self-directed activities. SECR, UOSER. Textbooks, Giddens Concepts for Nursing Practice, 3rd ed., Van Meter and Hubert Gould's Pathophysiology for the Health Professions, 7th ed., Lewis's Medical Surgical Nursing in Canada, 5th ed. Or Pharmacology Notes Unit A, Fundamentals of Nursing Pharmacology, Central Nervous System Regulation, Mood and Cognition, Elsevier. Student Supports, Success Strategies, Leverage your nursing experience, collaboration with peers, prioritize self-care, effective learning in asynchronous weeks. Connect theory to practice. Use your clinical experience to link pharmacotherapeutic concepts with real-world scenarios. This will not only help solidify your understanding, but also enhance your ability to critically think about pharmacology in practice. Ask about real-world applications in both synchronous and asynchronous sessions. Ask the instructor how theoretical knowledge can be applied in clinical settings, especially regarding patient care, drug interactions, or medication management. Reflect on learning. After completing each module or lesson, take a moment to reflect on how the new information fits with what you already know from clinical practice. This will help reinforce and integrate your knowledge. Integrate into clinical practice. Try to apply pharmacotherapeutic concepts in your own practice or work environment. If you're able, discuss these applications with colleagues to enhance your professional development. 2. Form study groups. In online courses, collaboration is key. Join or form a study group with fellow students to discuss difficult topics. Sharing notes or discussing case studies can help deepen your understanding and make learning more enjoyable. Use WhatsApp or similar. Tier teaching. Take the opportunity to explain complex concepts to classmates. Teaching others is a great way to reinforce your own learning. Balance work, study, and rest. Make sure to take breaks and not overexert yourself. Online courses can be intense, and as an experienced nurse, it's important to manage stress and avoid burnout. Maintain healthy habits. Sleep, exercise, and a balanced diet are essential too. Maintaining the cognitive focus and energy needed for an online course. Stay organized. For self-directed weeks, set a consistent routine to review. Materials. You may want to set aside specific times to focus on videos, readings, and assignments. Treat these tasks with the same importance as live sessions. And use active learning techniques. Engage with the content using active learning strategies, such as summarize each section in your own words to ensure understanding, and create flashcards for key drug classes, pathophysiological processes, and treatment regimens. Make concept maps to visually connect drug mechanisms, disease processes, and treatment outcomes. Set small, achievable goals. Break up your self-directed learning into smaller goals, for example, reviewing a module per day. This will help avoid feeling overwhelmed. Evaluations. Item time week due value. Clinical always due by Friday 23:59. 5 judgment action plan. 9, 10%, 20% total equal to 30%. Quizzes open Monday at 9, close Friday at 45% each. 17-10 total equal to 10%. Tests during class session 7, 13, 30% each total equal to 60%. Total 100%. Introduction to Functional Ability refers to an individual's capacity to perform everyday activities required for independent living, including self-care, mobility, and communication, including physical, cognitive, and psychosocial domains, Resources: Giddens, Chapter 2, Van Meter and Hubert, 2023, pg 168 to 183, 372 to 375, and Chapter 25. Lewis, 2023, Chapter 5, 60, 61.6, 2 pg 1568 to 1578. Pharmacology Notes, Unit A. Fundamentals of Nursing Pharmacology, Central Nervous System Regulation, Mood and Cognition. Describe example of disease and how it impacts functional ability. Overview of functional ability. Definition of functional ability, core components, clinical relevance. The capacity to perform daily living activities with autonomy and efficacy. Physical function, musculoskeletal and physiological capabilities. Cognitive function, mental processes such as memory and executive function, emotional well-being, psychological resilience and mood stability, directly influences patient quality of life and therapeutic outcomes. The nurse is assessing a patient's functional ability. Which patient best demonstrates the definition of functional ability? The nurse is assessing a patient with a mobility dysfunction and wants to gain insight into the patient's functional ability. What question would be the most appropriate? The nurse is collecting data from an older adult, age 65, to determine the patient's functional ability to perform activities of daily living, ADLs, which should the nurse acknowledge as normal physiological changes during her assessment. Select all that apply. The nurse is assessing a patient's ability to perform instrumental activities of daily living IADLs. Which activities are considered in the IADL's assessment? Select all that apply. Pathophysiology of functional impairment. Pathophysiological mechanisms. Alterations in physical function. Examples include muscle atrophy and joint degeneration, cognitive decline, conditions such as Alzheimer's disease and delirium, motor impairments, disorders like Parkinson's disease and multiple sclerosis, disease mechanisms, neurodegenerative processes, progressive loss of neuronal function, inflammatory pathways, immune system activation leading to tissue damage, traumatic sequelae, outcomes from physical injuries affecting functional capacity, factors and illnesses affecting functional ability, chronic health conditions, aging, neurological disorders, musculoskeletal issues, mental health challenges, arthritis, stroke, dementia, Parkinson's disease, traumatic injuries, alterations in physical function, pathophysiology, degeneration of articular cartilage leading to joint pain and stiffness. The disease process involves inflammatory cytokines that exacerbate cartilage breakdown and alter joint mechanics. Example: osteoarthritis, functional impact, reduced range of motion, decreased ability to perform weight-bearing activities, and increased difficulty with tasks requiring fine motor skills. Example: sarcopenia. Pathophysiology, age-related loss of muscle mass and strength due to decreased muscle protein synthesis and increased muscle degradation. This is compounded by hormonal changes and reduced physical activity. Functional impact: increased risk of falls, diminished ability to perform daily living activities, and decreased overall physical endurance. Example: Alzheimer's disease. Cognitive decline. Pathophysiology, progressive neurodegeneration characterized by the accumulation of amyloid plaques and tau tangles in the brain, leading to synaptic dysfunction and neuronal loss. Functional impact: impairments in memory, judgment, and executive function, affecting the ability to manage daily tasks and maintain independent living. Example: delirium. Pathophysiology, acute confusional state, often triggered by underlying medical conditions, medications, or metabolic disturbances. It involves fluctuations in consciousness. And cognition, functional impact, rapid onset of disorientation, reduced attention span, and altered perception, complicating the management of chronic conditions and increasing fall risk. Motor impairments. Example: Parkinson's disease. Pathophysiology, neurodegenerative disorder involving the loss of dopaminergic neurons in the substantia nigra, leading to motor symptoms such as tremors, bradykinesia, and rigidity. Functional impact, difficulty with voluntary movements, postural instability, and challenges in performing tasks that require fine motor control and coordination. Example, multiple sclerosis, MS. Pathophysiology, autoimmune demyelination of central nervous system neurons, leading to disruption in nerve signal transmission. This results in diverse neurological symptoms depending on the location of lesions. Functional impact, muscle weakness, spasticity, impaired coordination, and potential cognitive changes affecting mobility and daily activities. Chronic pain. Pathophysiology, chronic condition characterized by widespread musculoskeletal pain, often associated with tender points and accompanied by fatigue, sleep disturbances, and cognitive issues. The exact etiology is unclear, but is thought to involve central sensitization, functional impact, persistent pain and discomfort, affecting the ability to engage in routine activities and maintain a quality of life. Example, fibromyalgia, pharmacotherapy and its implications, pharmacokinetics and absorption, distribution, metabolism, excretion, pharmacodynamics, pharmacological and for cognitive decline. Examples include donepezil, Aricept, and memantine, Namenda. For motor impairments, examples include levodopa, Sinemet, and baclofen, Lioresal. For joint degeneration, examples include NSAIDs, ibuprofen, and DMARDs, methotrexate. Agents, considerations and adverse effects, potential side effects and contraindications. Drug interactions, synergistic or antagonistic interactions with other medications. Adherence challenges, TIN ensuring patient compliance with prescribed regimens. Donepezil, Aricept, pharmacology, cal agents, and examples, cognitive decline. Mechanism of action, acetylcholinesterase inhibitor that increases levels of acetylcholine in the brain. Functional impact, improves symptoms of memory and cognitive function in early to moderate Alzheimer's disease. Considerations, potential side effects include nausea, diarrhea, and bradycardia. Memantina bixa, mechanism of action, NMDA receptor antagonist that modulates glutamate activity to protect neurons from excessive stimulation. Functional impact may help in managing symptoms of moderate to severe Alzheimer's disease by improving cognitive function and reducing agitation. Considerations, side effects may include dizziness, headache, and constipation. Levodopa, carbidopa, Sinemet. Mechanism of action, levodopa is a precursor to dopamine, which when combined with carbidopa, increases dopamine levels in the brain. Functional impact reduces symptoms of Parkinson's disease, such as tremors, bradykinesia, and rigidity, improving motor function and quality of life. Considerations, long-term use may lead to motor fluctuations and dyskinesias. Pharmacology, cal agents, and examples, motor impairments, baclofen, Lioresal. Mechanism of action, GABA-G receptor agonist that reduces spasticity by decreasing excitatory signals in the central nervous system. Functional impact, alleviates muscle spasticity and improves muscle control in conditions such as multiple sclerosis or spinal cord injury. Considerations, possible side effects include drowsiness, dizziness, and muscle weakness. NSAIDs, ibuprofen, naproxen. Mechanism of action, inhibits cyclooxygenase COX enzymes, reducing the production of prostaglandins that mediate inflammation and pain. Functional impact provides symptomatic relief from pain and inflammation in conditions such as osteoarthritis and rheumatoid arthritis. Considerations, risk of gastrointestinal irritation, renal impairment, and cardiovascular events with long-term use. Methotrexate. Mechanism of action, DMARD that inhibits folic acid metabolism, reducing immune system activity and inflammation in autoimmune diseases. Functional impact, slows disease progression and alleviates symptoms in rheumatoid arthritis and other inflammatory conditions. Considerations, possible side effects include liver toxicity, bone marrow suppression, and gastrointestinal disturbances. Patient history. Application of pathophysiology to subjective assessment. How does disease or illness impact? Gather information about the patient's medical history, including any chronic conditions, previous injuries, or surgeries that may affect functional ability. Patient's perception. Explore the patient's subjective experience of their functional ability. Ask about any limitations, challenges, or changes in daily activities. Assess the impact of impaired functional ability on the patient's quality of life. Application of pathophysiology to objective assessment. How does disease or illness impact? Physical examination. Functional assessment. Perform a thorough physical assessment, focusing on mobility, strength, coordination, and balance. Evaluate joint range of motion and muscle strength to identify any impairments. Observe the patient's ability to perform activities of daily living ADLs such as dressing, grooming, eating, and ambulation. Use standardized assessment tools to quantify the level of functional impairment. Cognitive. Assess the patient's cognitive function, as impairment may affect assessment, decision-making, and safety during activities. Psychosocial. Consider the patient's mental health, emotional well-being, and social assessment support, as these factors can influence functional ability. Adverse effects. Monitoring for and managing potential side effects and interactions with other medications. Considerati. On-in. Medication-drug interactions, management. Understanding how other drugs or substances may affect the efficacy or safety of prescribed medications. Adherence issues. Addressing challenges in medication compliance, including patient education and support strategies. Adverse effects. Consideratio. NSN. Medication management. T. Continued. Monitoring for and managing potential side effects and interactions with other medications. Lab values. Assessment factors. Implement strategies to mitigate adverse effects, such as dose adjustments or symptomatic treatment. Educate patients on recognizing and reporting side effects promptly. Drug interactions. Understanding how other drugs or substances may affect the efficacy or safety of prescribed medications. Best medication history review. Education. Adherence issues. Addressing challenges in medication compliance, including patient education and support strategies. Develop individualized adherence strategies, such as pill organizers or reminders. Address barriers to adherence, such as complex regimens or side effects, and provide ongoing support and encouragement. In a patient with multiple sclerosis, which of the following is the primary pathophysiological process that leads to functional disability? Which pharmacologic class of drugs is commonly used to manage muscle spasticity and improve functional outcomes in patients with spinal cord injuries? Which of the following is the most important assessment finding when evaluating functional disability in a patient with Parkinson's disease? In patients with spinal cord injury, which of the following assessments is most critical to prevent complications that may worsen functional disability? A 70-year-old patient with functional disability, secondary to chronic osteoarthritis, is prescribed a non-steroidal anti-inflammatory drug, NSAID. Which of the following assessments is most important to monitor due to the pharmacological effects of the drug? A 65-year-old female patient has been admitted to the medical surgical unit. The nurse is assessing the patient's risk for falls so that falls prevention can be implemented if necessary. Select all the risk factors that apply from this patient's history and physical. Select all that apply. Acetazolam 250 mg by mouth 4 times per day is ordered for a patient with glaucoma. Acetazolam is available in 500 mg tablets. How many tablets would the nurse administer with each dose? Answer with a number only. A patient is receiving amoxicillin 250 mg by mouth every 8 hours. How many milliliters would be administered with each dose? Answer with a number. The healthcare provider orders 40 milligrams of a medication to be given by mouth now. Each tablet contains 0.02 grams of medication. How many tablets would the nurse administer with each dose? Answer number only. The New Fundamentals of Nursing, 11th edition, Clinical Judgment Model. 7. Clinical Judgment Model. Assessment components, definition, systematic collection of data to understand the patient's current state of data collection, gather subjective and objective data through patient history, physical examination, and diagnostic tests. And identify needs. Tools, use assessment tools such as functional status scales and cognitive assessment instruments. Clinical context, consider the patient's background, including comorbidities and lifestyle factors. Hypothesis formation, definition, development of potential explanations or diagnoses based on the assessment data. Components, differential diagnosis, generate a list of possible conditions that could explain the patient's symptoms. Clinical reasoning, apply knowledge and experience to prioritize potential diagnoses based on the likelihood and impact. Collaborative input, seek input from interdisciplinary team members if necessary to refine hypotheses. Clinical judgment model continued. Definition, examination, and prioritization of hypotheses to determine the most likely diagnosis and immediate needs. Analysis and components, data analysis. Evaluate and synthesize assessment data to confirm or refute hypotheses. Risk assessment. Identify and prioritize risks related to the patient's condition, such as acute symptoms or potential complications. Clinical prioritization. Focus on the most critical issues affecting functional ability and safety. Prioritization. Definition. Development of a tailored care plan to address the identified needs and priorities. Planning. Components, goal setting, establish clear, achievable goals for patient outcomes, focusing on improving functional ability and managing symptoms smart. Intervention planning, select appropriate interventions and treatments based on evidence and best practices. Patient involvement, involve the patient and their family in the planning process to ensure the plan aligns with their preferences and values. Clinical judgment model continued. Implementation, definition, execution of the care plan and interventions. Components, action steps, carry out planned interventions, such as administering medications or coordinating. Therapies, monitoring, continuously monitor the patient's response to interventions and adjust as needed. Documentation, accurately document all actions, patient responses, and any changes to the care plan. Evaluation, definition, systematic assessment of the effectiveness of interventions and overall care plan. Components, outcome measurement, evaluate whether the goals set during planning have been met, and assess improvements in functional ability. Feedback, gather feedback from the patient and healthcare team to assess the impact of interventions. Adjustment, modify the care plan based on evaluation results to address any ongoing or new issues partially met, unmet. Checkboard for groups, CJM applied to functional ability. Spinal cord injury, groups to apply model to simple case studies. Delirium, go to discussion board and work in your randomized groups. Dementia, remember to apply pathophysiology reasoning throughout Parkinson's. Arthritis, muscular dystrophy, osteoporosis. Asynchronous, week 2 pain